This first presentation is really just about how did I get here? How did all of this kind of happen, and why are we doing what we do? So I love to start my presentations with this quote that I heard from a psychologist who lost his son to a rare disease. A rare disease may also bring rare gifts: perspective, resilience, creativity, compassion, connection, and love. This resonates with me so much, and I'll tell you that I don't wish rare disease or illness on anyone, but for me, it was probably the best thing that ever happened to me. So, the genesis of the Sumaira Foundation. This was me 11 years ago. I had just gotten hit hard with this rare disease called neuromyelitis optica spectrum disorder. And I lost vision in my right eye, and then my left eye, and then I couldn't walk for a little bit of time. Thankfully, because of modern medicine and great doctors and whatnot, I am where I am today, and I've been in remission for 7 years. But thank you. Thank you. But it was a really tough journey to get there. Nobody around me knew what NMO was. I was living in Boston, receiving care at Mass General Brigham, Harvard Medical School, and even they were all kind of scratching their heads at the time, like, what is this? Why is she getting sick so rapidly? Why is she losing all of her vision? And I felt so alone. So I took to my blog at the time, and I wrote about what had happened to me. And overnight, my blog had received 15,000 hits, which for me at the time was a lot, but even today it would be a lot. And that gave me this idea that maybe this happened to me for a reason. Maybe I'm supposed to raise awareness of this. I used to work in the entertainment industry as a child up until my early 20s, and then I studied public relations, and then I was working in the healthcare system in Boston. So putting all these ingredients together and receiving this quote, there was a flower in her heart. It just needed more room to bloom. And when she let it free, she showed the world that sometimes the most beautiful things can grow in the darkest of places without the need of light. It just occurred to me, I have to do something about this. And even if I help just one other patient, it's worth it. So within 2 months of my diagnosis, I launched the Sumaira Foundation. At the time, it was just dedicated to NMO. And now, we are dedicated to raising awareness of NMO, SD, MOGAD, and other rare neuroimmune conditions, passionate about building communities of support for patients and their caregivers, like events like today. We support research, and we advocate on behalf of patients. We are proud to be truly patient-led, patient-powered, science-driven, and therapy-agnostic. Our icon is this flower. If you haven't noticed, they're kind of everywhere, which symbolizes admiration and high esteem for someone. Our mascot is a unicorn. Here we go. And this unicorn came to be our mascot after a 6-year-old patient living with NMO lost her battle to the disease, and she loved unicorns so much. So as a way to honor her, we decided to make our mascot a unicorn. And when I look at rare disease patients, I think you guys are all unicorns. And our colors are pink, marigold, and orange. We believe that diversity is a superpower, and that's reflected in the disease states that we represent, but also our International Medical Advisory Board, our Global Ambassador Program, our multi-language content and programming, and we have legal entities kind of spread out all over the world. We are, of course, based here in the United States, but there is a TSF, is what we call ourselves for short. TSF France, TSF Italy, TSF Germany, TSF, what else? Canada. And we're actively expanding into the UK and the Middle East, but that doesn't mean that that's only where our work is confined. It's just where we have local country organizations. Our website is available in 26 languages. I felt this was very important. My parents, English is not their first language, and when I got sick, they really did not understand what I had. So making the information that's already so difficult to understand in your native language available in other languages helped them understand better. Some highlights about the organization. So we've shared 175 stories from patients, caregivers, and clinicians all over the world. We've produced about 140 webinars in 13 languages. We've developed the first ever interactive therapies chart for the FDA-approved NMOSD therapies. We have 103 ambassadors representing over 30 countries. We've now organized, this is the 16th patient day in 3 years. We have support group meetings in 10 countries. We funded about $1 million in research and seed grants since 2018. We've graduated 7 fellows from our diagnostic fellowship, and we're a recipient of 2 PCORI funding awards, which I'll tell you about momentarily. And on the advocacy front, we've gotten 40 states in the US to recognize March as NMO Awareness Month and April as MOGAD Awareness Month, and we co-developed the first ever guidelines for diagnosis and treatment of NMOSD and MOGAD in Latin America. So of course it takes a village. I am not the only person working on all of this. These are all the people on our core team, our board members and strategic advisors, kind of all over the world. This is our list of doctors from the Medical Advisory Board and the countries that they represent. In the world of neuroimmunology, a lot of these doctors are what I like to call the big kahunas in our diseases, so we're very fortunate to work with them. These are all of our industry partners who help us achieve our goals in awareness, community research, and advocacy. We work with community partners all over the world. So these are fellow patient advocacy organizations, medical associations, ECTRIMS, which is like a huge meeting that happens for MS and related conditions, and all of the above. Our ambassador program, which we have 2 ambassadors here today, these are essentially patients, caregivers, and clinicians who represent the foundation and kind of lead the mission in their local territory. As I said, patients, caregivers, clinicians, scientists, researchers, and advocates. These are just some stats. Our ambassadors are sources of hope, information, inspiration, knowledge. You know, people, they're like influencers, I would say, in their local geographies. They offer peer-to-peer support. They are leading the way. They are leading by example. They are paying it forward because most of these folks, when they got afflicted with whatever disease they have, also felt the same thing that I felt, which was loneliness. So how do we now give back to other folks who are feeling what we once felt? These are many of our ambassadors. Programming, so we're very, very passionate about patient education. I believe that knowledge is power, and just speaking from personal experience, getting smart on my own disease helped me advocate for myself better, and I do believe that that leads to better health outcomes. So we have webinars, podcasts, infographics, charts, you name it. They're all on our website and social media. We just launched this new TSF brochure for understanding NMOSD and MOGAD in English and in Spanish. This is something that I wish I had when I was first diagnosed. I was left to go look on the internet and find out that I had 5 years to live. So I don't want patients to have that experience anymore. We have guides on how to effectively incorporate shared decision-making into your care. We illuminate the darkness by sharing stories. So we have stories on our website in prose, but we've also filmed a few documentaries. So this is a thumbnail from one of our award-winning documentaries called Animaux Bonjour in France. We were a finalist at the World Health Organization Film Festival in 2023. While we didn't win, I just think it's great that Sharon Stone watched this movie and liked it. So that's a win for me. I was in a documentary on PBS a few years ago about NMO. You saw me cry here, so I guess it's okay. I cry a lot in that one, so just brace yourself. These are where we have support group meetings kind of all over the world. We're very focused on mental health, wellness-focused initiatives, so we have a few programs focused on that. These are all the places we've done patient days so far. So the pictures are from Milwaukee, Dallas, LA, New York City, Verona, Italy, Paris, France. This was in Copenhagen, last year in Denmark, Boston, Cleveland, Atlanta, Miami, Paris again, Verona again. This was Beijing last year, Stanford earlier this year in San Francisco, Washington, D.C. in June, and most recently we were in Chicago in July. And we are going to be doing a photo like this too this afternoon, so we gotta like make it even better than these. We have an app called NeuroSum. It's a symptom tracking app. The unicorns, as you see everywhere, we have a pediatric support program. So anytime I become aware of a person under the age of 18 who is afflicted with really any rare disease, I send them a care package with our unicorn stickers, bracelets, and a handwritten note just to maybe brighten up their day a little bit. We do advocacy work, so we have a patient advocacy council which addresses access challenges to therapies, our Coalition for Health Equity, which addresses gaps for underserved communities. We celebrate March as NMO Awareness Month and April as MOGAD Awareness Month. I understand that February 22nd is World Encephalitis Day. Does SPS have a day? When is it? Okay. It's every day. Yes, it's every day. This was a sign we had in Shanghai, China to recognize China NMO Day. These are all some of the illuminations that we've had around the world to recognize our special month. So I love pink. The color of the foundation is pink. These are just a few of the illuminations, but every year our ambassadors get landmarks around the world lit up for the cause. This was our Belgian ambassador at the European Parliament advocating for early detection of rare diseases, and a bunch of us on Capitol Hill for Rare Disease Week on Capitol Hill. Some of the patient assistance programs we work with here in the United States, so the PAN Foundation, the Assistance Fund, Good Days, and NORD. I do believe they have programs available for SPS, AE, neurosarcoid, and CNS vasculitis as well. So they provide support with copay assistance, sometimes with Uber rides to and from your infusion. So definitely check it out. They're on our website. Research. So we have 2 research grants that we give out. So Spark Grants is for adult research, and Joanni's Unicorn Grant, which is in honor of the little girl, is for pediatric research. We have funded $830,000 supporting 32 research projects around the world since 2018, alongside supporting fellows to learn live cell-based assay testing, which is very helpful for rare diseases like ours, so that patients get diagnosed accurately, quickly, and all of the things. So it's a train the trainer program. We've graduated fellows from Iran, Zambia, Sri Lanka, Brazil, Egypt, and Belgium. This is our newest fellow from Romania. She's going to be at the University of Oxford for a couple of years, focused on NMOSD and MOGAD. These are some of the journal publications that we supported, focused more on MOGAD in the Frontiers in Neurology. We have research summaries on our website and on social media. So what is this? There is so much research coming out about our diseases. And if you're not a science person, which I'm not, a lot of it kind of goes over your head. So we have a team of people who take these research articles and make them into plain language summaries so that we can understand them. So they're all on our website. And then to the 2 PCORI funding awards. So in 2024, we received a $250,000 funding award to develop a research agenda for rare neuroimmune disorders. And because of that, earlier this year, we received a $9 million funding award to conduct the first ever international comparative effectiveness trial for the 4 FDA-approved NMOSD therapies versus rituximab. This is going to be an international trial with sites in the United States, France, Italy, Germany, Japan, Korea, Canada, and so on and so forth. We're going to be enrolling 560 patients over the next 5 years, and this has never been done by a patient advocacy organization in rare before, so there's going to be a lot that we learn, and we're hoping that all of these learnings and findings can be applied to other rare diseases. These are just some of our research initiatives that we're focused on. It's a laundry list. You can find it on our website, so I won't bore you. And this is my favorite picture. So this was us in Beijing last year, celebrating our 10-year anniversary. We're now 11. But I love to show this picture because Michael here hates it. But I love it. He's wearing a little birthday hat, and it's so cute. So anyway, this is how you can find us on social media. Visit our website. Once again, I'm so grateful to each and every one of you for being here. I really hope it's worth your time. Take notes, ask questions, make friends. You can cry. I already did. We'll laugh, we'll eat, all the things. But now we'll get to the more important part. We'll be meeting the doctors. Thank you.